The aim of this demonstrate this difficult case is to show a cataract surgery with phacoemulsification after TRAB and AGV in a case of uveitic glaucoma. Now we have to carefully choose the site of the side ports away from the AGV and also little bit anterior to the bleb so that it does not disturb the bleb, and preferably the main incision should be away from the tube, and mostly the open space where we get is main port is the temporal side. So now we have done the side port superior and supero-nasal side port is being made to avoid touching the bleb, and inferior side port is being made. Now we are performing routine staining of the anterior capsule under the air bubble. After the washing the dye, the next step is preferably what is recommended is we should use cohesive Heal-On viscoelastic during capsular access. Now it's an early posterior subcapsular cataract. After performing hydrodissection and hydrodelineation, we will be doing routine phacoemulsification surgery under low fluid parameters. Now we are using a blunt chopper with 2.2 millimeter phaco handpiece, 2.2 millimeter needle in a earthly Faros phaco machine. So it's a case of secondary glaucoma due to uveitis. So minimum handling of the uveal tissue should be done during the surgery. We are carefully, slowly removing the cataractous lens. So we should not touch the uveal tissue, and also we should avoid touching the AGV. And remember that we should try to keep the fluid away from the AGV tube, because if the cortical or the nuclear fragments gone into the tube, it may obstruct the tube and thereby hamper the drainage of the aqueous humor post-operatively. So after doing IA, I am going to do the IOL implantation under hydro. Under irrigation, after completing the irrigation aspiration of the cortex, the clue is keep the irrigation into the anterior chamber and do these steps in slow motion so that we do not touch the AGV tube, or we should have a controlled removal of the nucleus or the cortex, because we don't want any fragment floating into the AGV tube. So the clue is, because it's supposed uveitic glaucoma, uncontrolled glaucoma in which TRAB and AGV already being done. So we have to do the routine phacoemulsification without touching the iris or uveal tissue, and also simultaneously do the controlled removal of the nucleus and the cortical fragments. We can see under irrigation IOL is implanted. Now it will be dialed into the bag with the help of Y. So the surgery is done. Routine hydro closure of the wounds will be done.